Okay, so we did our project on cystic fibrosis and Trikafta. So what is cystic fibrosis? It is an inherited life-threatening disorder that affects the lungs and digestive system, and it is caused by mutation in the cystic fibrosis transmembrane conductance regulator, also known as the CFTR. And it is most often known for its effects on the respiratory system, but the disease can also affect other organs that produce mucus. And it also has been discovered that there are 2,000 mutations of the CFTR gene that lead to CF. So how cystic fibrosis, also known as CF, was first understood as its own disease in 1938. It was originally looked at as a side effect of celiac disease, and celiac disease is an immune reaction to eating gluten. So scientists discovered what CF was while doing autopsies on very malnourished infants. In their discoveries, they found mucus blocking glandular ducts. And then in 1948, a pediatrician named Paul de Saint-Agnes noticed in infants with heat prostration, and this can be compared to heat stroke. He concluded that children with CF were excessively sweating and releasing an excess of chloride and sodium through their sweat. And unfortunately, at that time, life expectancy was around 6 months after a time of diagnosis. And in the diagram on the slide, this shows the progression of the discovery of CF.
So kind of what does CF affect is, so the reason it's so problematic is the fluid and mucus buildup, which is caused by the mutation to the CFTR gene. And that gene regulates the amount of protein that is produced, as well as how it does its job, making how it gets to where it's supposed to go, which is on the surface of the cell. And it's supposed to regulate ion and water flow, but if it's not doing that, a lot more mucus is produced and it's difficult to expel, and it can block passages, and it's most notably seen in the lungs. But yeah, she said most organs have some production of mucus, which can therefore be affected, most notably the pancreas and reproductive system. And here are our forms of cystic fibrosis. So each parent carries a gene that will be passed down to their child, and for someone to have CF, they need 2 genes of that cystic fibrosis gene. And there are 5 classes, and while there are over 2,000 mutations, we can group them into 5 categories. So we've got class 1, 2, 3, 4, and 5. And just small descriptions up here on the screen, you can see there are different level of severities, and then there are different levels of drugs that we can use. Like here we see over all of these, and the one we are going to be focusing on later is seen right down here, and it's Trikafta.
Okay, so the symptoms and issues. So the symptoms is salty tasting skin, like coughing, pneumonia, or bronchitis, shortness of breath, weight gain, weight loss, loss of appetite, like your bulky stools, and sorry. And then the issues are usually like respiratory, digestive, and reproductive. So for like how it affects like the respiratory system is it causes like change in the electrolyte transport system, which causes like the cells in the lungs to absorb too much sodium and water, which causes the lungs to be like thicker than like usual. And then in digestive system, like it clogs like the ducts of the pancreas and like prevents like pancreas from like producing like necessary enzymes. And then for reproductive system, it blocks the sperm canal. And then that's just like a picture of like the pathways. So the history of the treatment is like the treatment was often like it's still like there to like manage the complications and like the symptoms. Like recently we have figured out like therapies and stuff, but these are all been like very recent discoveries. And then they are not effective on all forms of cystic fibrosis, but it's still effective. Like it still like helps the patient. Also cystic fibrosis does like limits the quality of life because like you have like very like limited amount of like physical functioning, and most patients unfortunately die very young because of like all the complications cystic fibrosis has. And then the most well-known treatments, like you can either manage or like take medications. So like managing would be like removing excess mucus from lungs, like getting proper nutrients, and like preventing like lung infections. For medication, you can do antibiotics, anti-inflammatory medications, like mucus thinning drugs, and then like medications that help target like cystic fibrosis causing genes.
And actually the most common path that a cystic fibrosis patient will end up going on is getting a transplant. Oftentimes it is lungs, but some people will have really severe issues going on in other organs because we've already discussed it, but it does affect a lot of different organ systems. And really the only way to truly start over kind of with that pattern with a fresh set of lungs is to get a transplant. And so now looking at Trikafta specifically, Trikafta is a specific drug that is used for about 90%. It can be used for about 90% of all cases, which is a lot, but it's definitely not enough. We still need to do that other 10%. It's a combination drug that was approved by the FDA in October 2019. And what I mean by combination drug is it's got a combination of potentiators and CFTR correctors. So potentiators are used to increase the probability that the CFTR channel will remain open. And the correctors are to help correct the shape and the misfolding of the CFTR protein, as well as its transportation to the cell surface. And so Trikafta bonds to different places on this F508 del CFTR protein production sites. And the specific drugs used are elexacaftor, tezacaftor, and ivacaftor. And the first two are used to help with just getting the CFTR protein to the surface. And once they're there, ivacaftor helps them remain open longer and do their job more in the proper way. And so we do have a little video here, and it is just going to show how Trikafta works by showing you first the normal function, and the second half should show you what a CF patient's lungs look like. And you'll notice that because you'll see little circular things, and those represent the proteins, and you'll see less later on. And then you'll also see more mucus buildup, and that is what happens essentially. One moment, please. And so you're seeing these proteins are getting through like they're supposed to. And now they are not getting through like they're supposed to. And now we're going to see what happens on the other side, which is mucus buildup. And this discovery was a really big deal because we were actually able to target proteins themselves and their functions rather than what we had been doing before, which was adding proteins, trying to add artificially created proteins to the person, and that was not working. And that's just kind of a testament to our innovation in the medical world.
So some data, the first graph shows the comparison between Trikafta, which is the newest and most promising drug on the market to treat CF, and Symdeko, which was also a drug that has been in use already. And as you can see, Trikafta has much better results compared to Symdeko. And at the 4-week mark, lung function improved by 10%, 10 percentage points from using Trikafta. And then the second graph shows the median age of survival for both male and females who have been diagnosed with CF. And the age of survival has almost doubled from 1974 to 2012 for both male and females. But although women do have a younger death rate compared to men, which is around 5 to 7 years younger.
So this is a really important topic because as all of us would like to be nurses, we are going to see these patients in the field because unfortunately CF is still a pretty prevalent issue. We're also hopefully going to be part of the generation that helps cure CF because it's not crazy to imagine that within the next 50, 60 years, there's going to be a big change in terms of CF treatment, whether that be a real cure or just really effective treatments. We don't know, but we're going to be hopefully part of the generation that does that. And it's also just really important in general to pay attention to these new developments in medicine. And Trikafta is a great example of that because it was just approved about a year ago and is doing great things. You can actually see, if you really are interested, you can look up testimonies from people. There's people on YouTube who make videos about having CF and they talk about it and how much it has changed their lives. And here's our works cited.